Okay. Hello, my name is Chris Wong, and I will be talking about the signs and symptoms of a transient ischemic attack and what to do immediately after. A few weeks ago, my dad had a transient ischemic attack. He asked me to come over to help him out of the garden. Since it's been quite a while since I last visited home, I said, sure, why not? While I was helping him out in the garden, we were catching up and I asked him a question, and then all of a sudden, he began mumbling and slurring his words. I couldn't understand anything that he was saying, but soon after, he dropped his gardening tool and proceeded to pick it up, but then he dropped it again on his way back up. He then tried picking up the tool once more, and then he dropped it again. When he was about to make his third attempt, I stopped him and helped him find a place to sit down. And then I quickly realized that these were symptoms of a stroke. So I rushed him to the hospital because the hospital was only 6 minutes away from our house. The doctor said it was a good thing that I caught the symptoms and was able to get him to the hospital so quickly. As it turned out, my dad said that same morning he had double vision when he first woke up, which is very unusual and out of the norm for him. My dad was then injected with the dye into his bloodstream and had an MRI taken for further testing. Due to the possible risk of TIA or stroke, the doctor had my dad stay at the hospital for a few more days for further observation and testing. Being well informed and taking action right away is absolutely critical in these types of situations. First, I will discuss the signs and symptoms, the causes, the risk factors, and prevention of a transient ischemic attack. When looking for the signs of a transient ischemic attack, I remember the acronym FAST. My girlfriend is a nurse, so I'm constantly hearing her drilling this into my head all the time, especially since her uncle had just had a stroke this past year. So for the acronym FAST, F stands for face drooping, which includes weakness or paralysis of the face. A stands for arm weakness, which includes difficulty lifting the arms up or lacking in grip strength. S stands for speech, which includes slurring and having difficulty understanding. And T means it's time to call 911. Transient ischemic attacks, or TIA for short, is also known as a mini stroke, but unlike a stroke, the blockage is very brief and there is no permanent damage. Transient ischemic attacks are the most common type of stroke. Every year, up to 500,000 adults in the United States have TIAs. Most of these people will go on to have more TIAs or even stroke in the near future. A TIA occurs when there is a clot blockage that prevents the supply of blood to the brain. The underlying cause of a TIA is typically caused by atherosclerosis. Atherosclerosis is a buildup of cholesterol that contains fatty deposits known as plaque on the inner walls of the arteries. This plaque reduces the overall diameter of the artery walls, thus increasing the chances of a blood clot to get stuck. A TIA can be caused by something other than blockage of the arterial wall. It can happen from spasms in the arterial wall that is caused by smoking, exposure to the cold, extreme emotional stress, and through the use of illegal drugs, particularly amphetamines or cocaine. A TIA can also be caused by not having enough oxygen reaching the brain. This can occur as a result of illnesses such as leukemia, anemia, or even carbon monoxide poisoning. And then here is a diagram of a transient ischemic attack. Here you can see the plaque buildup on the interior arterial walls, and here's the blood clot being stuck. And you can see that there's even more clots behind it building up. And then here's a diagram that shows the difference between a transient ischemic attack and an ischemic stroke. A transient ischemic attack shows the blockage is temporary, but it eventually goes through. But the blockage for an ischemic stroke is stuck indefinitely. Moving on to risk factors. There are some that are genetic and are out of your control, and there are other risk factors that you can control. The risk factors that you can't control are age, because risk drastically increases after the age of 55. Sex, because men have a higher risk of a TIA and stroke than women do. Family history, because there is greater risk if other family members have also had TIA or stroke. Sickle cell disease, because stroke is a frequent complication of sickle cell disease due to the sickle-shaped blood cells being limited on the amount of oxygen carrying potential, as well as the tendency of sickle-shaped blood cells getting stuck to the arterial walls. And prior transient ischemic attacks, because if you've already had a TIA, the chances of having another one greatly increases. Normally, if you are male over the age of 55, have African American or Hispanic heritage, the risk of a TIA goes up even more. Other risk factors include hormone replacement therapy and oral contraceptives. The risk factors that you can control are high blood pressure, high cholesterol, cardiovascular disease, excess weight, and diabetes through the maintenance of simple lifestyle changes. Okay, prevention of TIA. The most effective way to reduce the odds of having a transient ischemic attack is by knowing and understanding your risk factors and living a healthy life. By getting regular checkups, avoiding smoking, because smoking increases the risk of blood clots and raises blood pressure and contributes to the development of atherosclerosis. Limiting cholesterol and fat intake, because saturated fat and trans fat can increase the risk of plaque buildup on the inside of the arterial walls. Eating plenty of fruits and vegetables, because folate, potassium, and antioxidants can protect you against a TIA. Limiting sodium intake, because too much salt can increase the risk of hypertension, which increases blood pressure. Exercising regularly, because exercise can lower your blood pressure naturally, and limiting alcohol intake by drinking in moderation. Avoiding use of illicit drugs, particularly amphetamines and cocaine, and maintaining a healthy weight, because it will indirectly keep blood pressure and cholesterol levels in check. Seeing how common transient ischemic attacks are in the United States, by bringing awareness and being well informed, this information can help anyone be quick to recognize the signs of a TIA or stroke. Timing is crucial, because it can be one or the other. No matter the situation, a TIA is an emergency and should always be treated as if it were a stroke. A TIA is normally a warning sign that a massive stroke is coming in the near future. Always be sure to remember the acronym FAST and look for the signs of face drooping, arm weakness, speech slurring, and get ready, because it may be time to call 911. Thank you for being an amazing audience, and I will see you next time.